Hello everyone, welcome back to Dr. Coda's medical coding classes. So today I am going to discuss chapter 18, symptoms, signs and abnormal clinical and laboratory findings not elsewhere classified. So the code range for this chapter is R series R00 to R99. First one is symptom code. So when we should code for symptoms in ICDs? The first one is when a related definitive diagnosis is not established. That is, patient comes with some symptoms and the diagnosis for that symptom is not established. Means we can give the symptom code. Next one is use of symptom code with the definitive diagnosis. That is, in the documentation there is a diagnosis. Then when we have to use the symptom code. So the condition is when sign or symptom is unrelated to diagnosis, which means that patient have some diagnosis and some symptoms or sign which is unrelated to that particular diagnosis. For example, if the patient is having acute appendicitis as a diagnosis and the patient is also having a chest pain. So this chest pain is unrelated to diagnosis, that is acute appendicitis. No, in that case we can code for chest pain along with code for acute appendicitis. Okay, so the symptom should be unrelated to the diagnosis that we got. In that case we can code symptoms along with diagnosis. Next one is combination code that includes symptoms. So what is combination code? Combination codes means that codes for which a single code represents two conditions. It can be either a diagnosis and a complication or two diagnoses or a diagnosis and symptom. So here it is telling about a diagnosis and a symptom. Okay, in that case there is no additional code needed to be used for symptoms. Okay, so what are all the cases where we have to code for symptom? First one, when diagnosis is not established. Second one, when an unrelated symptom is established along with the diagnosis, you can code the unrelated symptom. And third one, combination code, where a diagnosis and symptom is having a single code. In that case also we will specify symptoms. Next one is repeated false. The code for repeated false is R29.6. So when we have to code for this R29.6 repeated false, that is when a patient has recently fallen and now the patient comes to hospital to know the reason for fall. Okay, what is the reason for fall is being investigated. In that case, you have to code for repeated false R29.6. Okay, then next one, history of falling. The code is Z91.81. We have to use this code when patient has fallen in the past and is it at risk for future falls. Okay, that is when patient has a history of past falling means you can use this code Z91.81. Next one is COMA scale. The code for COMA scale is R40.2. It should be always a secondary code after the diagnosis code. Okay. So this code should be used to assess the intensity of coma. Okay. To measure how much is the coma intensity, we are using this R40.2 codes. So this COMA scale code is used in conjunction with traumatic brain injury codes, then acute cerebrovascular disease, then sequelae of cerebrovascular disease. In all this case, to assess the intensity of coma, we are using this COMA scale. Okay, COMA scale codes. So here, when you look at the tabular list, you can see that this COMA scale is measured by three different categories. First one is eyes response, how it is eyes opening is measured. Okay, then the second one is verbal response and the third one is motor response. In that way, you have to measure the intensity of a coma and you have to code accordingly COMA scale code. Okay, so the seventh character in this R40.2 series, seventh character indicates where the scale was assessed. Okay, that is like if it was assessed at the emergency department or at the hospital admission or 24 hours after hospital admission, like that, where the scale was assessed, that indicates a seventh character of COMA scale. Okay. So the next one R40.24. R40.24 represent Glasgow COMA scale, that is the total score. Then do not report COMA scale code for patient with medically induced coma or sedated patient. If the coma is medically induced, or if it was a sedated patient, that is the patient is given sedation and comes to coma, in that case you cannot code this COMA scale. Next one is SIRS due to non-infectious process or systemic inflammatory response syndrome due to non-infectious process. So, if systemic inflammatory response syndrome develops due to non-infectious process, for example, for this non-infectious process include trauma, malignant neoplasm, pancreatitis. In that case, the first code should be the underlying condition and the second code should be R65.10 or R65.11. Okay, for example, if systemic inflammatory response syndrome occurs due to malignant neoplasm, means the first code should be the code for malignant neoplasm and the second code should be R65.10 or R65.11. Here R65.10 is SIDS without acute organ failure and R65.11 is SIDS with the associated organ dysfunction. Okay, so if the condition is R65.11, that is systemic inflammatory response syndrome due to non-infectious process with the associated organ failure, means you have to additionally code for the associated organ failure. Next one is death NOS, death not otherwise specified. So when we have to code for death. Okay, so first the code for death is R99. It should be coded only when the cause of death is unknown. Okay, the code description is ill-defined and unknown cause of mortality. That is, the cause for death is unknown, means you can take this code R99. Next one is NIHSS Stroke Scale, National Institute of Health Stroke Scale. Okay, similar to COMA scale, we have another scale, that is stroke scale, to assess the intensity of a stroke. Okay, so the code for stroke scale is R29.7. It should be used along with the stroke codes. Okay, so the first code should be acute stroke codes and the second code should be NIHSS stroke scale if given. Okay, this stroke scale is to identify patient's neurological status and severity of stroke. Okay, to assess the severity of stroke and also to identify the neurological status of the patient. It should be always sequenced after diagnosis code. So this is a very easy and simple chapter. If you have any doubt, means you can ask in the comment section. Thank you.